Okay guys, so today is day 10 after my Lapiplasty Bunionectomy, and I had a doctor's appointment yesterday. I'll try to make this brief, but okay, doctor's appointment. First time you've been back to the doctor's office since you've had the surgery. Your foot is still completely wrapped. You haven't seen it for this situation, it was 9 days. You don't know what it looks like. Okay, so here we go. So we get to the doctor's office, which is on the second floor. I'm in crutches. I'm with my boyfriend, luckily. We go to we go in. I'm in crutches. Somehow I go up the hill to get into the surgical center. We're waiting in the elevator, get in the elevator on crutches. I just have to keep saying on crutches because it sucks. Get out. I had pre-registered, so I go into the doctor's office. There's kind of like a line at the registration thing, but one of the registration people or nurses asked my name. I give it to her. She's like, okay, you can just sit down. So I sit down. They call my name pretty quickly, maybe like 5 minutes go by. They open the door. The nurse is like, says my name. I'm on crutches. She's like, just follow me. Of course. Where I'm going is the very end room at the end of the hallway. So I'm in crutches, hobbling by, nurses, doctors, probably some patients. Everyone kind of like stops and looks at me because, let's face it, they have to make room for the girl in crutches. I'm maneuvering slowly, but I'm okay with the crutches, but I still got this bandaged foot. I get back to this room, find out it's the x-ray room. And they unwrap my leg because it was wrapped in that, I don't know what that is, but they unwrap it, and then all that's left is all the gauze from foot to leg. I believe it was the x-ray technician, although maybe it was a nurse, I don't even know. But she proceeds to take her scissors. Okay, you're free. You got to realize you don't know what's going to hurt, blah, blah, blah. She takes her scissors and starts cutting through the gauze. So emotionally, you're like, oh my God, is she going to cut my leg? What if she accidentally cuts the scissors? What if she bumps it? You don't know what's going to hurt. She does fine. She cuts it. She gets it out. There's my foot. Voila. So I get to actually see what happened or what my foot looks like, because when you get out of surgery, your foot's wrapped. You don't know. And I can see that so the cut is like, I don't know, it's a vertical line, kind of like on the top of your foot, and it's maybe like 3 inches long, and then it has butterfly tape horizontally across it. So, maybe like 8 pieces of butterfly tape down. It looks like a zipper, sort of. There's a little bit of bruising, not much, a little bit of swollenness, but not much. My foot, it looks good. But it's the first time it's been exposed. It's the first time I've seen it. I don't really know what's going to hurt. I don't know what's happening. Then she tells me she's going to do some x-rays, so I have to like put my foot flat on this x-ray board thing. So I do the flat foot, I do the side foot, do the other side. She's taking x-rays. Nothing's hurting. I'm still like very scared, sensitive to my foot. Then she says, okay, then what she's going to do is she's going to take these pictures and she's going to send them to another computer, so I have to go to another desk. or another office. So she's like, okay, just follow me. So I'm going to the doctor's office now. I'm going to get to talk to the doctor about the foot and find out what's happening. But to get to the doctor's office, she says, follow me. Now this girl is like walking so fast. I'm trying to follow her on crutches. Webby's, my boyfriend's with me. He's holding my stuff. We get to the doctor's, the next examination room. I'm telling you, it's the very end of another hall. So again, I'm walking by all these people. Not one person says, hey, we should get her a wheelchair or anything. They just all stop and look. There my bare foot is now out to the wind for everyone to see. It's embarrassing. It's just uncomfortable. It's weird. And of course, I'm like internally freaking out because I had surgery. I just saw my foot. All these people are staring at me. The nurse is walking too fast. It's a lot. I go into the doctor's office, and then there's an examination table. She's like, just hop up here. Well, I can't just hop up there. There's a stepping stool, but I'm not putting weight on my right foot. And how am I supposed to step on the stepping stool? Like, if I put my left foot on the stepping stool, then I'm on my right foot, bearing weight. If I put my right foot on the stepping stool, I have to push pressure on that to get up on the table. The examination table, like I'm 5'2", so like it's like mid-waist. So, and my hands hurt from crutching, because when you're using crutches, you use the palms of your hands like crazy. So like they're bruised. You can't really tell, or I would show you. But end story is my boyfriend has to lift me up so that I can sit on the examination table. Then intern doctor comes in who is very businesslike, has no real bedside manner. She's looking at my foot. She's moving my toe around, saying that she said the x-rays came in. I got to ask some questions. Like I said, well, this is the girl that told, when on the day of my exam, she introduced herself or the day of my surgery, she introduced herself as the intern and asked me if I was getting the fusion. So I'm like, was something fused? And she's like, well, yes, of course. And I'm like, what? And she says, well, did you see the video? And I said, yeah. She said, well, the video shows how like this metal thing gets in your foot and they fuse it to another bone or something. I don't know. I'm like, oh, okay, that was the fusion. Okay, got it. And then I'm like, well, now that we're talking about the video shows that, when you get to surgery, you can walk within 3 to 5 days. And then she kind of laughs and she said, well, that's extreme case. She said, we really try to be careful, and we don't want to push people. So long story short, they're going to give me a boot and I'm going to wear it for who knows, I don't even know how long, but I can't really bear weight for another week. That's what I'm told. So I'm going to be wearing crutches for another week with a boot that I can, slowly bear weight on. So I don't know. I'm seeing myself probably in crutches for 2 more weeks, probably longer. Who knows? They do all kinds of stuff to the foot. I don't have a lot of time in this video to tell everything, but moving it around, acting like it is a stressful situation. No one really tells you what they're doing. They treat it's an emotional experience, but they treat you as if you are just like a piece of meat. Like, here's your foot slab. Move it this way, move it that way, move it up. She secures it. We have some situations where she tries to put like this tube compression sock on my foot. She grabs your foot like in a fist, kind of, and is going to stick it in this sock. I'm like, no way. That is going to hurt. No. I was going to do it, but then I couldn't even do it because I was afraid it would hurt. So, end story is, I leave. I have a boot, which is right here. See? Can you see? I don't know if you can see it, but that's my new attire. And so I have the boot, and I can bear weight next week. Oh, I asked what would happen if I bared weight too soon. Like, in my imagination, is it gonna, like, all the insides of it is it gonna break my sutures and flop out, or is it gonna bleed? And he said, really, the only thing that will happen is I might have pain. So you just gotta, bear weight until you're uncomfortable. So I'm gonna try that. I'm gonna slowly bear weight on it. It doesn't really hurt that much. It just kind of has like a burning sensation. That's it. So, day 10, post-operation. And I'm doing okay. Not walking. If you think you're going to be walking by day 10, doubt it. Doubt it very much. In fact, I think I'll be lucky if I'm walking in a boot without crutches in a month. So, to be continued.